I want to go across live and exclusive on the Newstrack to the Union Health Minister, Dr. Harsh Vardhan. He's joining us. It's a big day for him. Dr. Saab, swagat hai aapka. First day of phase 2. What was it like for you? You were monitoring what's happening across the country. What are your overall impressions, Dr. Saab?
No, thank you, Rahul ji. I think it has been a very good day, very fine day. Started with the Prime Minister, I think, leading by example. And all through the day, I've been watching the developments very closely. And when I monitored at 6 o'clock, some 2 hours, 2.5 hours back, already almost 23 lakh people had in fact registered themselves on the COVID platform for taking the vaccine, and how many took it today and all that details are also awaited. And I think it has been a very successful day, and as the things grow further during the course of the next few days and weeks, I know that it's going to grow up exponentially, and it is going to be very, very successful. We already have achieved significant success in our fight against COVID, and I am sure that this vaccination drive will certainly help us in achieving the ultimate success.
So there were some complaints about some glitches on COVID platforms, software issues, connectivity issues. How soon do you think, because now the volume of people trying to register will be much more than earlier, how confident are you that you'll resolve them, and how soon do you hope to be able to do so, Dr. Saab?
You see, I am fully confident. Ours is a very, very robust platform. You see what happened that today morning when the Prime Minister took this jab, after that when this news broke out, there were, I think, millions of people who had actually gone on the platform. And for some time there was you see this platform had gone down, but that was just whatever had happened was before 10 o'clock. But since 10 o'clock in the morning till now, the platform has been working very, very efficiently. It is a seamless, you see, working on the platform. And we are confident, even if there is approach by millions of people, the platform is going to work very, very efficiently. We have tested it time and again. And today itself, after that initial glitches, the whole issue has been taken care of.
Okay, looking ahead, currently Zydus Cadila, Russia's Sputnik 5, Biological E, Genova, the other vaccines which are in the pipeline and at advanced stages before launch in India. How soon, Health Minister, do you believe that these other vaccine candidates will be available in the Indian market?
You see, it may not be wise for me to predict any particular date, but as you have yourself mentioned, that these vaccines are in very advanced stages of the clinical trials, especially the phase 3 trials and all. And one of them has, I think, already applied for emergency use authorization, etc. So I think in the coming months we should have a few more vaccines in the market. That is what I can say at the moment.
There was a fair amount of criticism when the government gave approval to Bharat Biotech's Covaxin candidate. There has been no major side effect experienced or negative fallout since Covaxin was administered starting in the first phase, and today the Prime Minister himself has publicly affirmed his personal faith by injecting it into his own system. Is there a sense of vindication that you have, Minister, that your government previously took the right decision, and in the way that it's panned out, that decision has been validated?
You see, as far as I am concerned, right from the day one, I had already, you see, I was thoroughly convinced that whatever approvals have been given, they have the backing of science, they have the backing of the expert committee, they have the backing of data. And all those concerns and issues that were raised in the media or on the social media platform, I had answered each one of them with, you see, scientific support systems. So as far as the government is concerned, we have never any doubt about the safety of Covaxin and its immunogenicity, etc. And now, you see, already 1.35 crore healthcare workers and these frontline workers have received both the vaccines. Both the vaccines have been exported to 28 countries. Even the developed countries have received Covaxin, and they are happy, and they are expressing their pleasure and satisfaction and gratitude to India on record. So I think you are right. It's all this is a vindication of what we have been observing all through, and never ever has all these statements that have been made by people to make it a political issue or to disturb the overall situation on the vaccine front. They have never disturbed us in any way. We have kept our karma process on, and we will continue to fight with utmost dedication and sincerity that we have been doing for the past over 1 year under the leadership of our Prime Minister, till we achieve ultimate success in our fight against COVID.
You know, so far, Minister, vaccine supply was tightly regulated because it was largely being administered by the government on the margins by the private sector. Now, private sector's involvement has gone up, which means it's essentially in the hands of doctors. How anxious are you that this could lead to misuse in terms of distribution, that there could be black marketing? What are your plans to try and curb that? Is that something which is of concern to you?
No, I think the system is keeping a close watch on everything. There are detailed guidelines for the states also to monitor things, and even at the district level with our immunization officers and our district magistrates all over the country being in charge of the situation. They have planned things at the local level. So everything is being very well monitored, and I have full faith in the ability and the sincerity of the private sector. They have helped in the fight against COVID all through the year, you see, even for testing and other things. So at a personal level, I am not very apprehensive about the apprehensions that you have raised, but certainly we are going to keep a close watch on everything and will not allow any absurdity of any nature happening in the system, whether in the government or in the private sector.
Acha, one question, Mantriji. This is a slightly personal question. You know, I'm very happy that all the ministers got their vaccines today. The Prime Minister also. Those above 60 are now entitled. Those above 45 who have comorbidities are entitled. But जो बाकी लोग देख रहे हैं वो सोच रहे हैं कि हमारा नंबर कब आएगा? So as of now, you're saying phase 2 will take 3 months. So we're in March, April, May. When does the rest of the population under 45 without comorbidities, उनका नंबर कब आएगा, sir?
You see, what these priorities have been fixed up, they are based on, you see, observations and the data of the last 1 year, not only in India but all across the world, and of course with guidelines which have been framed by the World Health Organization. That is how these priorities have been fixed up. 80% of those who got this morbidity and mortality during COVID, they were all above 50 and all. So it has been, you see, this is guided by a very definite scientific basis. So according to that basis, we are going step by step, and as soon as we proceed further, so depending upon what the scientific needs of the community, less than 45 are, we will do it at the appropriate moment. So everyone has to wait for his or her turn. Like the people who were above 60, they have also waited till March 1 for their turn.
So any thoughts at this moment about the new academic year? I've got young children. We're wondering as a family when they'll be able to go back to school. As India's health minister and as the man responsible for keeping us all healthy and safe, what are your thoughts, Minister, about when children can start going back to school?
You see, personally, I have a feeling that as long as if we can really enforce discipline in the community, or whether it is in schools or whether it is for any other place or function or workplace, in terms of maintaining the sanctity of the COVID appropriate behavior, there is nothing to worry, because we have seen over the last 1 year that for transmission of the COVID virus, you need to be very careless about the COVID appropriate behavior, and if you are careful about it, you can really handle the things very well. So a bit of sincerity on that front, a strengthening of the monitoring systems, and wherever we have seen that there is laxity or there is, you see, complacency on the part of the society or the people about following the COVID appropriate behavior, because people think that the vaccines have come, the trend in the country is on the very sharp declining phase, so they can now relax and they can do whatever they want, they need not take the precautions. I think that is something which needs to be reinforced again and again, and this is where I feel that media people and people like you with the very distinguished channel, they can all ensure that this remains a big movement amongst the people of the country.
Finally, there's been a lot of comparison between India and China. India's vaccine diplomacy winning applause the world over. Is that something which is a matter of satisfaction? It was a tough decision because there's so many people in India waiting and anxious to be vaccinated, yet the government said that we are part of a global alliance, we will be exporting vaccines even if that delays our own rollout. But now that decision of your government is winning so much applause and goodwill for India. How are you reflecting on, you know, so much being written and said about how India's vaccine diplomacy is working so much better than China's so-called vaccine diplomacy? Everybody asking for Indian vaccines, Desi vaccines, rather than Chinese mal.
You see, we are not doing this vaccine diplomacy at the cost of or compromising the safety of our own people. We have tried to strike a very good quality balance between what are the needs of the people of India and what is our duty for the rest of the people of the whole world. And this vaccine maitri or vaccine diplomacy, whatever you can call it, it has been, I think, very carefully planned and deliberated, and there is a group of ministers and very senior distinguished secretaries there, and of course the guidance of the Prime Minister, where the Ministry of External Affairs is planning all that in consultation with the Health Ministry and of course the drug manufacturers and the Pharmaceuticals Ministry. So I do not want to comment on any other country or what their vaccine diplomacy is, but we have a sense of satisfaction that under Prime Minister Narendra Modi the vaccine issue, supported of course by the scientists and the vaccine manufacturers, it has brought us, you see, a lot of laurels, and it has made us proud of our capabilities. We were already you see, 60% of the vaccines for the developing countries were being supplied by India. We were already called a pharmacy of the whole world, and now there is no doubt that we can easily be called the vaccine hub of the whole world.
Well, this is indeed a big day for you personally, for your ministry, and for the Indian government and the Indian people, the start of phase 2 of the vaccination program. And as more and more people who are vulnerable get vaccinated, the sooner it will be that the country can be back on its feet fighting this virus. We wish you all the best, and thank you for the effort that you're making. Dr. Harsh Vardhan, thank you for taking out time to join us on the Newstrack. Thank you, sir. All the best. Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.